Hello, my name is Matthew Connor and I am a surgeon at Tallahassee Ear, Nose, and Throat. Today we are talking about adenoids. The adenoids are a tonsillar type of tissue which is located at the back of the nose just behind the soft palate. The adenoids, because of their location, can potentially block the back of the nose above the palate. The adenoids can physically grow into the back portion of the nose and disrupt the adequate movement of air. This can lead to a number of different problems, including snoring, chronic mouth breathing, obstructive sleep apnea, and dental misalignment. The adenoids also can impair the drainage of mucus and lead to chronic runny noses. It also has been proposed as a source for repeated sinus infections. Also, the adenoids are important for the health of our ears. As you can see in this diagram, the adenoids are directly adjacent to the eustachian tubes and are felt to contribute to ear disease for a variety of reasons. The eustachian tubes connect the middle ear with the back of the nose, and they are important to equalize the pressure in the middle ear. The adenoids can sometimes be large enough that they can mechanically obstruct the openings of the eustachian tube and therefore block air from getting up into the ear and fluid from getting back out of the ear. They also potentially serve as a source of constant bacteria, which can then go up the eustachian tubes and repeatedly infect the ears. Generally, an adenoidectomy is used as a supportive measure in children who have had a repeated need for tube placement, or for those who have had other symptoms of adenoid enlargement in conjunction with their ear problems. The removal of adenoids is called an adenoidectomy. The procedure is done while asleep under general anesthesia. The adenoids are usually carefully removed through the mouth with angled instruments. The risks of the adenoidectomy are relatively small, including a small risk of bleeding, less than 1%, which is significantly less than the risk of doing a tonsillectomy. Removal of the adenoids can potentially cause a decreased ability of the patient to close the palate when speaking or drinking, leading to the escape of air or liquid into the nose. This is called velopharyngeal insufficiency, and the risk is generally less than 1 in 1,500. Your physician will determine whether or not your child has a small midline defect in the musculature of the palate, which would increase the chances of the development of velopharyngeal insufficiency. An additional risk is the potential to develop scarring in the back of the nasopharynx, potentially leading to a narrowing of the nasal airway. This nasopharyngeal stenosis, or scarring, is an extremely rare postoperative complication. Adenoidectomy is frequently performed in conjunction with other procedures, such as placement of ventilation tubes in the ears or the removal of the tonsils. Please refer to those videos for more information on those procedures. After surgery, there may be a slight bit of blood from the nose. It sometimes recurs when the scab comes off the adenoid bed at 7 to 10 days postoperatively, but it generally will stop within several hours. Older children may complain of a slight dull headache and neck pain. Over-the-counter pain medication or the prescribed medication should take care of this. Foul drainage or odor from the nose will occur postoperatively for up to a week. You may also expect congestion and a low-grade fever as you heal. There is also a small chance that the adenoids may regrow over the years. We hope that this video has helped you to understand the risks and benefits of adenoidectomy and what to expect during your recovery. If you have any further questions or concerns, please contact our office at any time.